With that, I'd like to invite David Gray to join us for a staff update to that resolution. This is related to funding sources, partnerships, and opportunities to prioritize ongoing investments in our homelessness response system. Thank you. Welcome, Mr. Gray.
Thank you very much. Good afternoon, Mr. Mayor, Mayor Pro Tem, and City Council members. I appreciate the opportunity to present our staff response to your council resolution. But before I begin, I'd be remiss if I didn't thank all of the service organizations, the homeless response system funders, our policy planners, people with lived experience, and others who took time out of their lives and their schedules to be here with us this afternoon. And so just for all of you, on behalf of my office and my executive leadership team, thank you for the work that you do. Thank you for your partnership each and every day with our office. The work that you do and the time that you commit to helping us solve these challenges are not lost on us. As I mentioned, today's staff presentation is our response to this resolution that you all adopted in January of this year. I do want to note that the official budget recommendations from our office will be included as part of the city manager's budget proposal that will come out later in April. However, we did want to make it a point to put forth some funding considerations in front of you in response to Council Resolution 20250428joint, which adopted as guidance the State of the Homeless Response System report, emphasized matching clients with the appropriate interventions best suited for their success, directed staff to look into our ARPA investments as well as HSO staffing, ways to increase the utilization of our existing interventions, and capital and service funding needed to enhance our homeless response system investments, and also look into policy and administrative recommendations to finish our current permanent supportive housing pipeline and bring more units online. As we embarked on this journey, we set 4 key tenets to guide the work that we did. The first was that anything that we recommend must produce a measurable reduction in the prevalence of homelessness, meaning that our investments have to reduce the overall homelessness count in our city. The second is that we wanted to focus on investments across the homeless response system spectrum, beginning with prevention and going all the way to permanent supportive housing, making sure that we have multiple upstream and downstream opportunities to serve households regardless of where they're at in our continuum. The third is make sure that we're matching our interventions to the needs of those experiencing homelessness, and that our investments are used in a manner that serves people with the most appropriate interventions to meet their needs. And last is recognizing that the city cannot do this work alone. We need partner organizations to help fund homeless-related initiatives. You know, when we think about it, our homeless response system is sort of like a group of Clydesdale horses pulling a carriage. If you get one Clydesdale, that one Clydesdale has the capacity to pull 8,000 pounds. If you put 2 horses together, you don't get 16,000 pounds, you actually get 22,000 pounds. And if you train those 2 together before they pull, you don't get 22,000 pounds, you actually get 36,000 pounds of pulling power from those 2 horses. And our homeless response system is the exact same way. When we align our investments, when we align our programs, we optimize our success. Now, I'm gonna start with the bottom line up front, which is that our total investment consideration package totals just under $101 million. We'll get into the details of all these specific considerations as we go through the presentation. But I want to summarize that about 1/3 of these considerations are current one-time funding that we believe council should consider for ongoing investment. 1/3 is new investment considerations for the city, and 1/3 is new investment considerations for our homeless response system partners. But like I said, this slide is here as reference, and we're happy to come back to it as we get through the presentation.
Divide the thirds again.
Yes, sir. So 1/3 is current one-time funding from the city that we believe should be considered for ongoing investment. So that includes things like American Rescue Plan Act dollars that we're going to be talking about in just a moment. 1/3 is new investment considerations for the city. This would be things like adding more shelter beds to our shelter system or adding more service funding for permanent supportive housing units. And then 1/3 is new investment considerations that we're going to ask other homeless response system funders to work with the city on resourcing. And this is in recognition that we cannot fund this entire system alone, but we do believe that if we're able to align across all of our funding partners, we can optimize the outcomes in our system. So as we talk about the American Rescue Plan Act funding recommendations, I think it's first important that we begin with the look at how we've spent money as a city. And so the chart in front of you is city funding for homeless services across all departments. This does not include federal or state funds. And I do want to note that program names and funding sources have changed over time, so we did our best to approximate some of the older data. The key takeaway here is that we've scaled investments considerably in shelter and in housing throughout the past several years, even during the COVID years. And this is really evident when you look at our homeless response system's capacity, which this next slide shows. And as you can see, our system today has record-setting levels of shelter and housing, and I'm happy to say that we have more to come. Similarly, the majority of our ARPA funds for homelessness were used to enhance the capacity to get people indoors. And so when you look at this chart, things that stand out is funding that we dedicated towards rapid rehousing, towards our emergency shelter and our crisis services, and to capital investment to build new housing development. That's PSH and other levels of affordability. And so as our team dug into all of the programs that we funded through ARPA, we looked for impact, efficiency, and efficacy to identify 5 initiatives for council to consider continuing as these ARPA funds transition out. And so these programs total $15.65 million. They include an $8 million allocation for us to keep the Marshalling Yard open. The Marshalling Yard is the largest shelter in our system, serving just under 300 people each night. The second is a $3 million consideration for housing that's tied to our bridge shelters. This would help us get 80 to 100 people out of our bridge shelters, creating more capacity within those shelters for us to do more HEAL initiatives. The third is $2 million for street outreach, and you just heard a couple of folks today talk about the importance of street outreach and the lack of funding that we have available in that area. We'd like to be able to continue contracting with local organizations to support street outreach citywide. The fourth is $2 million for community-based emergency shelters, which would help them with capacity building and getting new units online. And the fifth is $650,000 towards the Downtown Austin Community Court. They have 5 staff who run a rapid rehousing program that supports approximately 100 clients annually. And we'll dig into more specifics into each of these recommendations as we go through the presentation. Now, I know a big focus of today is to talk about new capital and service investments, but our team thought it was prudent to look at our existing interventions to assess their effectiveness, identify gaps, and understand where improvements in the things that we're doing today can be made. This helps ensure that we are addressing any current shortcomings in our work and that any new investments that come our way build upon things that work. And so as we dig into the existing interventions, and we'll go intervention by intervention, these are areas where our staff have identified where we can enhance the interventions to help produce more housing outcomes. And I want to note that items with an asterisk on the screens are things that our office is currently phasing in or things that we're currently piloting. And so when it comes to homeless prevention, last week we just released a $2.2 million homeless prevention solicitation. Because that's a live solicitation, I can't go into details or answer any questions about that RFP. But at a general level, we want to make sure that we're using screening tools to identify and direct assistance to households at risk of homelessness. We want to keep households housed. We do not want to wait for households to lose their housing before we're able to help them. We also want to make sure that we're providing case management to at-risk households so they can stabilize in their current housing. We also want to make sure that we're deepening our partnerships with many of the providers and folks in the room today so that those households have a robust support system to help them stay stably housed, and making sure that any organization who receives funding from the city to do this work has flexibility to use those dollars in a way that truly supports the family. When it comes to street outreach, our top priority is prioritizing the employment of individuals with lived experience with street outreach roles, because those individuals have that unique experience and they're able to connect with people on our street. We're also working diligently to increase our shelter bed capacity so that our street outreach teams have direct access to shelter beds. We can get somebody indoors the same day. We want to make sure that our street outreach programs are tailored to meet the needs of unique populations. You heard earlier today from LifeWorks, and they talked about youth homelessness. It's important, for example, that we have street outreach workers who are specifically trained to work with youth, specifically trained to work with seniors, specifically trained to work with veterans. We want to leverage a geographic deployment strategy that prioritizes outreach to areas where we see higher homeless densities. That's particularly important for a city of our size. Our city is 300 square miles. So making the best use of the limited resources that we have is critical. We also want to make sure we're leveraging technology and mobile applications so that we can allow for real-time data entry and service coordination for outreach teams. And this is not just for city outreach teams. We want to make sure that anybody who's doing street outreach in our community has access to up-to-date data, up-to-date information on how clients are being served, who's serving clients, and what programs they're connected into. We want to make sure that we're standardizing our data and our key performance metrics so that we can uniformly assess the impact that people are having, hold our staff accountable, and hold our providers accountable. We also are talking with our sibling departments about placing outreach workers inside city facilities. As many of you know, our city facilities oftentimes serve as cooling centers in the summer months or warming centers in the winter months. It's a place where people go to get water, take a shower, or use a computer. And oftentimes it's those PARD rec center staff or those librarians who are trying to juggle both their city job and be case manager. And so we're working with our fellow department directors to make sure that we're able to provide them with support in those city facilities. And then increasing the number of medical practitioners that provide care directly on the streets or directly in encampments. Again, our goal is to try to get everybody housed. Unfortunately, we can't always do that the same day. But when we do come across clients with medical needs, we want to make sure we're able to address those needs as rapidly as possible. From an encampment management perspective, we are working with the Parks and Recreation Department and Austin Resource Recovery to decrease our reliance on external cleaning crews by building our internal staff capacity to facilitate more timely encampment cleanups and encampment closures. We're also leveraging technology to prioritize our service requests and automate how we do project scheduling and leverage GIS mapping. This is a significant staff time saving exercise. Right now, my staff probably spend 80% of their time just going through 311 call data, removing duplicate calls, and trying to work with outreach and our cleaning crews to schedule the appropriate type of follow-up. And so by leveraging technology, we could save some staff time and also be more responsive to public calls for service. We also want to be transparent with our community about the work that we're doing. Many people don't know that last year we did over 1,500 encampment cleanups and closures, but most people don't know that. And so we want to launch a public-facing dashboard with real-time data so that people can better track their 311 calls and our responsiveness to those calls for service. And we're talking about revising our HEAL initiative to customize housing solutions for our shelter clients. 70% of the clients who we brought in through the HEAL initiative are folks who classify as chronically homeless. We know from data that chronically homeless people do not do well in rapid rehousing programs. Yet to date, 100% of our HEAL clients who go through the city-funded services get into a rapid rehousing program. So we want to make sure that we're providing our bridge shelters with more customizable solutions to appropriately match the intervention with the folks who we're pulling in through HEAL. When it comes to diversion and rapid exit, one of our big initiatives that we've embarked on recently is strengthening our partnerships with local landlords to increase the availability of housing units for at-risk or recently homeless individuals. I know many of you are familiar with our recent partnership with Housing Connector, which we announced about a month and a half ago. And through that partnership, we've already secured over 2,300 units on their platform. These are landlords who've decided to make their units available, lower their screening criteria. So when we have individuals like the gentleman who spoke earlier about having a criminal background that keeps him from getting a lease, through the Housing Connector program, we're able to negotiate those screening criteria, remove barriers for individuals like that so that folks have a fair shot at getting indoors and continuing to progress with their recovery. We're also developing a citywide model for homeless diversion and rapid exit and looking at hiring or assigning housing navigators and case managers specifically for diversion and rapid exit program administration. Right now, a lot of people who do this work are juggling multiple responsibilities. But we want to make sure that we have folks who are specifically trained on diversion and rapid exit so that clients can fully take advantage of these services and take advantage of these services quickly. When it comes to our emergency shelters, I know many in our community have called for this, and we're working to bring this first point to bear, which is real-time bed availability across our shelter system and leveraging technology so that we could better manage real-time bed availability and so that the public can see what the real-time bed availability is across our shelter system. I will say on any given night, our shelters are between 90 and 95% full, but we want to make sure that people understand where our bed is available. This will also be extremely helpful for outreach workers so that they can quickly get folks out of the streets and into shelters. We want to make sure that all of our shelter staff are implementing proactive, housing-focused exit planning for all clients beginning day one. Let me be clear. Shelter is great, but shelter is not housing. It's important that we have shelter to get people off the street. We can triage their needs, but we want to make sure that we're able to get people into housing so that we can flip those beds and use those beds to serve multiple clients throughout the year. We also need to ensure that we have sufficient on-site support available and accessible to all of our clients. We've also had some conversations, some initial conversations around converting underutilized city property into engagement hubs or low capacity micro shelters. This would be 15 to 20 beds on a particular site. We've seen other cities do this very well, but we're still trying to figure out how to do this in Austin. And also improve holistic care by partnering with our medical friends and shelter staff and case managers to round on clients. At every shelter, we all know who those 10 or 20 or 30 high needs individuals are. And so by rounding on those folks in much the same way that your doctor probably has rounded on you when you were in the hospital, we're able to bring all of the different pieces of service together to make sure that we're coordinating the care for those high needs folks and getting them into the services that they need outside of shelter to help them in their homelessness. When it comes to rapid rehousing, my team has been working with our Continuum of Care's Leadership Council for several months to look into data-driven revisions to the coordinated entry system to ensure that clients are properly placed in rapid rehousing and other interventions. We're also working with our rapid rehousing providers to make sure that we're assessing clients' needs at the beginning and addressing barriers at program entry for every client, and that we're checking in with those clients at regular intervals. As I mentioned before, we're also implementing those landlord engagement strategies and incentive programs to make sure that we have more units available to our rapid rehousing providers. And we're working with our rapid rehousing providers to strengthen supportive services to ensure that we have appropriate case manager to client ratios, which is sometimes in the ballpark of 1 to 20, but I do want to caveat that that ratio can scale up or down depending on the needs of the clients within that portfolio. We also are working with our providers on new program guidelines that would enhance the stability for folks as they transition out of rapid rehousing by making sure that they have education in regards to their tenant rights, budgeting, good neighbor expectations, and other skills and knowledge bases that they need to be successful tenants on their own independently. And when it comes to permanent supportive housing, one thing that we're digging into right now is tracking the causes of move-in delays and working with our outreach teams to ensure that clients are move-in ready day one. Just last week, we were out at Katy Lofts celebrating the grand opening of that 100-bed permanent supportive housing building. And that's great. There was a lot of hard work that went into bringing that development online. And now we want to make sure that people are getting indoors as quickly as possible. We're also in conversations around launching a Bridge to PSH program that would streamline the lease up and prepare clients for housing opportunities, making sure that our permanent supportive housing providers have low case manager to client ratios. Again, somewhere in the ballpark of 1 to 15, but that can adjust up or down depending on the needs of the clientele. And as people move into permanent supportive housing and we start to fill up these units, we also want to think about what the future looks like for these clients. Ultimately, although permanent is in the name, we don't want everybody to be there permanently. And so implementing move-on programs and strategies that help people transition out of PSH and into other services so that we can make those beds available to new clients as needed. And last, when we talk about our homeless response system support, this is bigger picture, not intervention specific. Top for us is implementing continuous quality improvement methods and prioritizing data-informed decision-making. I know for my team, our budget and contract unit, led by Kelly, who's here today, has really been digging into performance reports, doing more desk audits, and looking at data to make sure that our city investments are having a high return on investments for our taxpayers. And when they're not, that we're having conversations with our providers about ways that they can enhance those services and what type of help do they need from the city and others to enhance their delivery. We're also collaborating with our homeless response system funding partners to improve the alignment of our funding streams, as well as what we're asking of our providers. So if a provider is stacking multiple sources of capital to do a program, they're not also having to juggle multiple program guidelines. They could spend more time doing the service, knowing that the funding is aligned and that the funding is secured. We're developing more in-house performance management tools to help us support active monitoring and assessment of program activities. And we've begun the process of scheduling recurring intervention-specific provider meetings to strengthen our networks, address common challenges, and enable more opportunities for capacity building. One I'd like to highlight would be every other month we meet with all shelter operators in the city, where we talk about challenges that all of us are facing, opportunities that we're all facing, potential impacts of federal funding cuts. We've had Central Health come in and talk about the work that they do around Narcan and MAP enrollments. And so we're going to schedule more of those intervention-specific provider meetings so that we can provide resources to our providers, we can help build our networks, and we can address common concerns. And so now the part that you've probably all been waiting for, which is capital and service investment considerations for the homeless response system. And I do want to note that some of the items in here you're going to see are things that we covered in the American Rescue Plan Act section, but we've included them and couched them within their respective intervention. So before I dive in, I had also mentioned that the city can't do this work alone. It takes many homeless response system funding partners to do this work. Our office has met regularly and will continue to meet regularly with other funding partners. These includes groups like our colleagues at Travis County in the Health and Human Services Department, our good friends over at Central Health, our colleagues in this work over at ECHO, Integral Care, which is our mental health authority, a number of philanthropic partners, several of whom are in the audience today, and a lot of our business and corporate partners. And I want to give a specific shout out to the Downtown Austin Alliance. Just last week, you all approved the funding recommendation from my office that allowed us to partner with DAA to enhance the level of street outreach that we're able to do in the downtown community. And so it really takes a robust and aligned network of funding partners for this work to pop. And so just on behalf of my office, I want to thank all of our funding partners for their support to date, and also look forward to talking to them more about how we align our funding, how we align our guidelines in support of the work that we're laying out today. So diving into it, when we talk about considerations for prevention, diversion, and rapid exit, we're asking council and the community to consider a $3.8 million investment in this area. Just for some context, we currently have several one-time funding initiatives that are couched within prevention, diversion, and rapid exit. This includes the $2.2 million homeless prevention solicitation that we launched last week, $500,000 that we invest in the Sunrise Wayfinder rehousing program, which is a diversion program, and $2.2 million for our contract with Housing Connector to help recruit more units into our system. We've also worked with ECHO to secure philanthropic funds for homeless prevention, and we've authorized our city shelters to provide clients with diversion and rapid exit support using funding that we've already allocated to those shelters. So as we think about how we move forward as a system, we are asking for considering converting the one-time funding highlighted above into ongoing funding. And this will allow us to sustain our important investments in prevention, in diversion, and in rapid exit. We also are going to, as an office, continue monitoring and evaluating these programs. For example, as part of our investment with Sunrise Wayfinder program, we also have a partnership with UT to help us evaluate the performance and the outcomes of those diversion funds and whether or not families are more stable and secure after they receive the diversion assistance. That type of research and analysis coupled with the funding allows us to make strategic and data-informed changes to programs as we go. And so we're going to continue to look at these programs and making modifications to guidelines as necessary. We don't have a specific funding recommendation when it comes to homeless navigation. However, we do want to provide some context for where we want our community to consider investing in this area. The first is just a recognition that the Sunrise Navigation Center does amazing work in our communities, literally serving hundreds of people experiencing homelessness every day. Through that Wayfinder program, Sunrise has housed over 120 individuals in 1 month. So it's just a sense of the scale of their impact. At the same time, they're the only full-service navigation center in Austin, which creates a couple of challenges. One is that there's a neighborhood around Sunrise that gets disproportionately impacted by the number of people having to go to Sunrise every day. The second is from our clients, that they're having to come from all across the city to South Austin to access these critical services. And so the consideration here is for the city and our homeless response system funders to collaborate on establishing a robust network of navigation centers that would more effectively connect individuals to housing and other supportive services and alleviate the impact that's currently borne by one single community. We think there are several options to achieving this goal. One is to incorporate navigation centers into our existing footprint, whether that's existing facilities or expansion plans. The other is by contributing funds for one-time capital as well as ongoing expenses to help operate these navigation centers. The amount of capital and operating dollars will depend on the size, the services rendered, whether or not we need to acquire new property or rehabilitate property, which is why we don't have a specific dollar value on this one. But this is one that my team and I will continue to evaluate. When it comes to street outreach and encampment management, just some context. As many of you know, our office has limited capacity to conduct street outreach on our own across our 300 square mile area. And that is why we partner with 11 different city departments and over 15 partner organizations for both outreach and encampment management support. An example of that is the work that we're doing here in downtown Austin through our partnership with DAA and Urban Alchemy on the Heart program. Now, last summer, we did a pilot program where we used some one-time funds in our budget to pilot a coordinated homeless outreach response structure. We funded 4 organizations to be a part of this pilot. Those 4 organizations were the Other Ones Foundation, Hungry Hill Foundation, Urban Alchemy, and Sunrise. And the pilot was successful in that it allowed us to, for the first time, really coordinate across different providers, have frequent collaborations, and leverage the collective strengths to overcome any weaknesses and also address urgent needs. And so coming out of that pilot, that's informed our thinking around an investment consideration of $5 million for street outreach and encampment management. This would include adding positions to HSO for outreach and enforcement, which I'll come back to later, extending our ARPA-funded initiatives by allocating $2 million for external partners to conduct outreach and encampment management, and also allocating the $3 million for our bridge shelter housing programs. The reason why bridge shelter is couched here and not in shelter is because bridge shelter is tied to HEAL. HEAL is an encampment management strategy. It's about compassionate encampment closures. As an administrative change, if this funding were to come to bear and we contracted with these partners, we would continue the success that we had from our summer pilot by mandating coordination between the partners to ensure that we have good quality control and that we're connecting unhoused individuals with the appropriate outreach service levels. And I'll come back to the slide if you'd like me to, but the table on the right shows how we envision outreach service levels for street outreach, from low-level services such as relationship building and providing hygiene resources, all the way to specialized services such as helping people with their permanent supportive housing enrollment packets or doing tailored street medicine for folks who are living unsheltered on our streets. When it comes to emergency shelter, some just quick context. The State of the HRS report that was produced earlier this year recommended 550 new shelter beds to our system by 2029. We went back and looked at some HSO analysis and found that this recommendation was consistent with an HSO shelter analysis that we presented to Council in July 2023. Our current existing ongoing budget for shelter operations is just under $20 million annually. Now, you all know that we've made a real investment in adding more shelter capacity to our system. And today, we have a record number of shelter beds in Austin than we've had in our history, which is why it's a record number, sitting right around just under 1,500 beds. And that being said, we still only have 1 bed for every 5 unhoused individuals, which means we have a lot of work to do to add more capacity. Now, our friends at the Other Ones Foundation are currently adding 100 beds at Camp Esperanza. Council invested $1 million in that project summer of last year. And Central Health is creating 50 medical respite beds. This says at Cameron Center, but I was recently informed that it's actually at another facility, and Cameron Center is coming down the line. But those 50 beds are coming. And then through hard work with the mayor's office last year, we've been able to jointly submit with the Other Ones Foundation, DAA, and TxDOT an application package to the state of Texas that would fund up to 400 beds out at Camp Esperanza. That's in addition to the 100 beds that's being added in phase 2. Now, we also looked at cost. How much does it cost to actually operate a shelter bed? And we want to give you both a floor and a ceiling. What would it cost just to do the basic bare minimum? What does it cost to actually get people into housing? And so what you see in front of you here is the cost for housing-focused shelter is around $34,000 per bed annually. But each of those beds serves between 3 to 4 clients each year. Because at that funding level, you're paying for the housing navigation and the case management and support that somebody needs to successfully transition out of shelter and into housing. But if all we wanted to do was provide a roof over somebody's head, a clean place to shower, and some food to eat, we'd be looking at $25,000 per bed annually. The trade-off is that bed is only serving 1 to 2 clients per year because we're not providing the wraparound services that people need to successfully exit and move on from shelter. And so when we think about considerations for emergency shelter, our math puts us at $32.3 million plus capital costs. And what this would include would be allocating $11.5 million to stabilize our existing operations. This includes $8 million for the marshalling yard, as well as $3.5 million for the 8th Street Women's Shelter. This also is looking at developing 550 new shelter beds by 2029. Now, the capital cost to do this will vary depending on the shelter size and some of the other applications that we currently have filed. The operating costs for these beds will range between just under $14 million to just under $19 million, depending on if we want to provide basic shelter or housing-focused shelter. And we believe that this is an area where we can have funders collaborate with the city on identifying where we put these shelters, how we co-fund the ongoing operations of these shelters, and making sure that people are exiting successfully. Also, you heard referenced by one of the speakers today, the $2 million seed fund initiative. Our thinking here is that under this structure, we could make investments, initial investments to help communities, organizations get shelter beds established. That could be for capital, or that could be to offset some of the operating expenses. But as those beds mature and as those operators are able to raise funds from other sources, we could then recapture a portion of those dollars and redistribute them to other non-city operated shelters. And we understand that sometimes community groups like to operate their own shelters. They like to dictate their own intake terms, their own case management terms, et cetera. And so this funding level would allow us to come in and help them support and stabilize without the city having to become overbearing on all of their operations. For rapid rehousing, our consideration here is pegged at just under $24 million. I want to start just with acknowledging that all of our currently funded rapid rehousing programs, city funded, are full. We do not have space for any new enrollments, and we're not expecting to have space for any new rapid rehousing enrollments until 2026. Our general fund budget for rapid rehousing is $4.5 million annually. Our ARPA allocation was approximately $12.3 million annually, but those ARPA dollars will be exhausted this year. Fortunately, we have a soft rental market, which means we have a lot of opportunity to engage landlords and get people into units quickly. And our State of the Homeless Response System report recommends just over 2,300 units, new units rapid rehousing to be produced between 2024 and 2034, which would be about 275 new units annually. When we look at the cost for rapid rehousing, we peg the cost for a well-resourced rapid rehousing program to be at $34,000 for singles and $40,000 for families. But I want to note that these dollar values are based off of the clients who are in rapid rehousing units today. I think many of us are aware that oftentimes clients who need permanent supportive housing are being placed in rapid rehousing. And so what you're going to see is that the cost of rapid and the cost of permanent supportive housing today are currently kind of the same, and that's because we're serving the same clientele. But the cost of rapid rehousing could decrease if we started to get lower acuity folks into that program, and the data shows that that's the direction that we should probably go. So when we think about the investment consideration, what we're thinking about here is a $650,000 allocation to extend the ARPA-funded Downtown Austin Community Court Rapid Rehousing Program. And then as a system, allocating $23 million to support rapid rehousing placements. A portion of that consideration will come from the city at $12 million, which would support the opening of 300 to 350 new units of rapid rehousing. And then we'd call on other HRS funders to partner with us in this space. We've heard from a lot of funders that they want to support housing investments and housing initiatives. They want to do things to help get people out of shelter and off the streets and into housing. We think this is a perfect place for those funders to align with the city by putting up additional resources to help us get folks into these units, help offset the rental assistance and provide the supportive services, and also align their program guidelines with the cities. Speaking of program guidelines, we are doing a wholesale update of our program guidelines for rapid rehousing. And so as we envision reopening placements in 2026, we're also going to have some new rapid rehousing program guidelines that's going to be based off of the lessons that we've learned to date. that's really going to help our providers get some clarity around the expectations from the city on the services. And that's ultimately going to help more clients being served transition from rapid rehousing into stable housing. And then we'll talk about our considerations for permanent supportive housing. And we'll do this in two chunks. The first chunk is looking at permanent supportive housing through 2027. These are units that are in our permanent supportive housing pipeline today. Next, we'll talk about units post 2027. The State of the Homeless System Response Report recommends developing just over 4,000 new units of permanent supportive housing between 2024 and 2034. We have a recurring funding in our budget for PSH services at $9.3 million. We also have $4.8 million in one-time funding for permanent supportive housing that's come out of the Budget Stabilization and Reserve Fund. And we're going to solicit those dollars jointly with Travis County and ECHO as part of the at-home program, and that solicitation is forthcoming. Now, of the units that we currently have in the pipeline, we have 585 remaining units to open before 2027. Of those, 391 do not yet have service dollars attached to them. And of those, 258 units are part of what's called the Travis County Supportive Housing Investment Pipeline, or the SHIP. These are units that are funded by a $100 million ARPA investment from Travis County. When we look at the cost of permanent supportive housing, a well-resourced permanent supportive housing unit costs $20,000 per unit for the supportive services. There's also a $15,000 rental subsidy that's attached to that unit, which is often funded through the housing vouchers. So in total, that package is a $35,000 package. So $35,000 per unit PSH, $34,000 per unit for rapid rehousing. One thing that we are tracking is that federal level staffing and funding changes could significantly impact the availability of housing vouchers and supportive services for PSH properties. And so cities, including ours, are bracing for there not to be a wide increase in federal housing vouchers. And so we're trying to figure out how we might be able to help offset that locally. So our investment consideration when it comes to looking at the units that will be delivered between now and 2027, the first is we would like to convert the $4.8 million one-time Budget Stabilization Reserve Fund allocation into an ongoing allocation. The logic here is that the permanent supportive housing units are here to stay, and we need to match our ongoing investments with ongoing funding. Paying for ongoing investments with one-time funding is going to get us right back into the hole that we found ourselves in as the ARPA dollars began to transition out. We're also, as a system, calling for a $7.9 million investment consideration to fund supportive services for units in the PSH pipeline. This would include a consideration of $2.7 million from the city to fund supportive services. Those are services in units that the city has invested capital dollars in bringing forth, and then calling on our HRS funding partners to provide the $5.2 million for the services at the SHIP-funded properties. We also recognize that funding can be phased in over time based on the fiscal year that a project is forecasted to open. And so I'm happy to come back to this slide if you'd like me to, because you could see every project as well as the projected lease-up year between now and 2027. We also want to make sure that our funding partners are prepared to support local organizations that might be affected by policy or staffing changes at the federal level. This could include things like staffing changes at HUD that make it harder for organizations to draw down on COC program funds, or staffing changes or funding changes that could happen at the VA that makes it harder for us to secure VASH vouchers, which are the housing vouchers that help us house our veterans. And now when we talk about post-2027, the context here is that significant capital, operating, and service funds are needed to build the additional 575 to 650 units that's called for in the state of the HRS system. We also recognize that the state of Texas restricts every region to only one PSH project funded through 9% LIHTC annually. The chart on here, which I won't go through in extreme detail in the interest of time, but what it does is it lays out the average amount that the city funds for capital, operating, and supportive services for every unit of PSH that's produced. And so for every unit of PSH produced, we typically will provide a one-time capital subsidy of $140,000, the one-time operating cost of $15,000, which is covered either through the federal housing vouchers or a local housing voucher. If it's a local housing voucher, it's from Manny DeMaio's office. And then our office provides the $20,000 per unit for supportive services. And so you could see that the annual cost and the total cost for creating more units is quite significant. And I will note that while this table does account for a 3% inflation rate across these years, it does not account for the potential impact of tariffs, which frankly, we're already starting to see the effects of tariff pricing effect, construction costs, and other labor costs within our area. And so when we think about post-2027, the investment consideration here is a $23 million annual increase through 2034. And what this looks like is making sure that we're increasing operating and supportive services through 2034. This would be another joint investment consideration for the city and our funding partners, with $6 million from the city to support 150 units and $17 million from our funding partners to support 425 units. And again, we're calling on our investment partners to help us in this area because we've heard from investment partners that they want to fund housing solutions. This is a great housing solution to invest in. We also looked at administrative changes. How do we actually bring these units to bear? And so one that we're focused on and having conversations on is a near-term shift from project-based PSH to alternative approaches such as global leasing and tenant-based PSH. This allows us to secure units that exist today that are sitting vacant in our community without having to invest all the capital to build new units. Now, if we're going to secure units today that are in apartment communities and in neighborhoods, we also must ensure that all of our program placements are conducted based on site-specific factors that can influence whether a client or a household is successful. This could include things like space for providers to operate on site if we're placing a lot of high acuity clients on one site, or looking at the number of PSH units in the property. And if there's not a whole lot of units, maybe we're providing those to lower acuity clients. We also want to make sure that we're maximizing our PSH production with any remaining or future bond funds. And we've been working closely with Manny DeMaio's office to look into that while also making sure that we're maintaining a balanced approach, because the fact is that our community needs housing affordability at all levels. And lastly is, as we think about new projects, making sure that we align our capital and our service funding strategies early on so we don't end up in situations where we have properties being built without the service dollars allocated. So I just want to, again, acknowledge that we have a call to action for our HRS funding partners, which across all the things that we touched on totals up to $16.2 million in additional funding above and beyond what they're currently doing, plus ongoing investment to help us bring more PSH units to bear. And I'm happy to come back to this slide and discuss this slide in more detail if you'd like. The last piece that I'll talk about is somewhat self-serving, but you asked me for it, so I'm gonna give it to you, which is the resource and staffing needs within the Homeless Strategy Office. And I thank you for the opportunity to share this with you. So our staffing, a lot of people don't know that our office, we have an office with staff. It's not just me, it's a lot of hardworking men and women who do this work day in and day out. I just get to post about all their hard work on LinkedIn every day. But we have 25 full-time employees and 7 temporary employees that are divided across 5 divisions: a policy and planning unit, a shelter operations and expansion unit, a public space management unit, which also does street outreach, a communications and engagement unit, and a finance and contracting unit. However, while we're happy to do this work and while we're committed to doing this work, our office is very lean, especially compared to other homeless strategy offices in other cities. For example, I don't have any backup leadership. And so when I'm out, our department becomes very vulnerable to disruptions in decision-making and coordination. That's why when people email me and I say I'm on vacation, they're like, well, why are you emailing me back from the beach? Well, that's because the work requires it. We also have 2 employees who conduct daily field work across our entire city area, our 300 square miles, which is frankly just insufficient for us given the high level of service requests. Every month we average around 700 service requests. And so to have 2 staff trying to cover 300 square miles to be responsive is a challenge, but again, they're committed to doing it. We also lack staff that are dedicated to managing data systems and technology, which limits our ability to operate efficiently and share insights with the public in a way that the public can know that we're making data-informed decisions. We lack a fully staffed communications team, which limits our ability to inform and educate the public about the work that we're doing. It also makes it challenging for us to engage with stakeholders, oftentimes our constituents who want us to attend their neighborhood association meetings or their business meetings, and we have to make them wait several months before we're able to follow up. We also have some challenges with translations and interpretation services. We do our best to work with CPIO to make sure that we're honoring the city's commitments around making information accessible. And we really appreciate CPIO's support in helping us deliver on our transportation and interpretation goals. Currently, our street outreach team and our public space management team are the same unit. This creates tensions and role expectations. It's also challenging, frankly, for us when we engage with clients in encampments, because they're wondering, are we showing up in our outreach capacity today, or are we showing up with Austin Police and Austin Resource Recovery to clear out their encampment? And so we want to make sure we can bifurcate those responsibilities. And then, of course, having the administrative functions like HR, accounting, et cetera, managed by other departments oftentimes can cause a delay in our ability to hire quickly or do contracting. And I want to give a lot of credit to the departments that we lean on. Austin Public Health provides us with HR support. FSD provides us with a lot of accounting support. CTM provides us with a lot of technology support. But when those departments are under-resourced or have their own staffing challenges, it delays our ability to do our work and to be responsive to the demands from the public. And so our staffing consideration is to really execute well on your vision for us and make sure that we're doing our part to lift up and optimize the system that we just talked about. We recommend considering allocating 40 new positions to HSO, the bulk of which would be allocated to encampment management and street outreach, but then additional positions to help us operate our homeless shelters, which is especially important as we talk about adding more homeless shelter capacity, help us with data and technology so we can look at data more efficiently and also share data with the public more clearly. Administrative support to help our office with some of the internal function needs, and then executive management so that I can go on vacation. No, I'm just playing. But it is helpful to have a deputy. We also have other needs to help us fulfill our jobs, things like case management software, city vehicles. My staff use their personal vehicles to do their outreach. You all graciously allocated 4 vehicles to us in this budget cycle, so we appreciate that. And then we're also looking at investing in laptops and tablets for us to do field work. And so next steps, and this is my last slide after speaking to you for 45 minutes, but I appreciate your time. While this presentation closes out our response to your council resolution, it does not end our work. And so we're going to continue to make progress on implementing the changes to the system that we discussed and shared with you earlier today. We're also going to continue our internal discussions around the investment considerations and staffing needs and figuring out our contingency planning should the considerations be unable to be met. And we're committing to meet with our HRS funding partners, provider communities, and others to share this presentation with them and continue to have conversations about how we align our work to optimize our impact. And so with that, Mr. Mayor and Madam Mayor Pro Tem, I appreciate all of your time today, and I'm happy to answer questions, but thank you.
Excellent report, but you're in charge. Well done.
Well done. Thank you. Colleagues, we will now take questions from...
No, don't give him any. He'll keep talking.
Why is this brown, Kelly?
So we'll have Councilmember Velasquez followed by Councilmember Quadri.
First of all, thank you so much for the presentation. That we always, appreciate you coming to present to us, but also all of the work that you do here for our in-house folks. In the short time that you have been here, I have seen a market change in how we do business, and I think a lot of the people in the community have seen a market change in how we do business, and that's greatly appreciated. I didn't know you got to take vacation though, so you can let us know how you get that done. We would be happy about that. I also wanted to thank you. You talked about data, and I know our offices are having a meeting later this week to talk about how we can better support you in that endeavor. Mm-hmm. I did have a question though. You were talking about your resources and staffing. Right now you have 25 on staff and you. What do our peer cities look like? So let's say Denver maybe.
Yeah, so Denver, as an example, we have 25 staff, and that includes me. Denver has 20 staff who only do outreach and engagement, as well as other staff who do all the administrative functions. So their outreach team is the size of my entire office.
And our outreach team is 2?
Our outreach team is 2 who do daily field work, and then 2 more who are screening 311 calls, doing coordination with other departments, giving me the information that I need, being responsive to y'all's requests when you submit CAFs or your constituents contact us for services.
I mean, that's everybody, not just D3, right?
Everybody.
Okay.
I'm sorry, y'all, the universal. But we have 2 staff who do daily. And also, we were just up in Dallas doing site visits up there for shelters. And I learned from their homeless strategy officer that they also have a 20-person street team as well. So that's just the size of these street teams is the same size as your entire team. Just about, yes, sir.
Okay, thank you. The second question that I have is on page 9, and this is just for clarification. You had wait, I'm sorry, it's page 10. Page 10 for the ongoing ARPA program funding. To be clear, that is just to continue at that level. Is that right? That 15.65 because of the ARPA funds that we are losing?
That is, so that would just be continuing at that level.
Okay,
yes,
I just wanted to clarify that because I wanted to make sure that I understood it properly. That's what I got. Thank you so much, sir.
Thank you.
Thank you. Councilmember Quadri?
Great. Thank you, Mayor Pro Tem. I just want to thank all the providers who have been out here today, all the voices. I want to thank David and his team. I know you have a great team behind you, but you're very much the face of it, and I appreciate your LinkedIn posts when you make them. I know this whole dais cares deeply about making sure we do right by our unhoused population, and we have the ideas, we bring forward the policy, but ultimately you guys are the ones who execute it. You guys are the boots on the ground, and I so appreciate it. I had 3 questions. I think I'm going to work kind of backwards from your presentation. On page 28. You had mentioned the conversation to do with PSH through 2027. Our office had brought forward a budget amendment in 2023 around PSH wraparound services. Has that money been spent yet?
Let me have my team look into that.
Okay.
And we'll get back to you.
Okay, great. Well, then I will move on.
You said that was in FY 23?
23, correct. Yeah, that was my first budget cycle. Great. So now I'm going to go to page 22. Something that I actually had an opportunity to talk with Councilmember Reinhold before when he was in, I think, the Bay Area for a graduation, seeing the street outreach team there. And we were really motivated to kind of bring that to life, here in Austin. Really appreciate the Downtown Austin Alliance. Really appreciate Bill at the DAA. But we had brought forward budget amendments around the HEART program. Just out of curiosity, what has the impact looked like? Do you guys have any any stats, any data behind that? So.
Yeah, the HEART program is fully operational. And again, I'm grateful for the Downtown Austin Alliance investing their dollars into that program. That allows us to put another full team on the ground within the Downtown Austin Alliance's boundary area. That team is active 6 days a week. It's 1 shift in the morning, a couple of shifts during midday, and then a shift in the evening. In January alone, they did over 800 engagements with people experiencing homelessness. It's also a great resource, not just for DAA, but also for our police department. Sometimes if our officers get calls for service and they show up and they recognize that it's just somebody sleeping or somebody who needs assistance, they will also call Urban Alchemy, and the Urban Alchemy outreach worker is able to engage in a way that kind of keeps things cool. Sometimes people don't respond to police very well. And so to have that partnership and that intentionality is really great. And it works the other way too. If Urban Alchemy engages with somebody and they become belligerent, they know that they can contact APD and APD will be responsive. That team is up first thing in the morning. I know because I text them at 6:30 when I'm driving down Congress, and they let me know immediately, yes, sir, we're going to deploy a team. So they're out there hard at work. But we're really grateful to have the funding. I've also seen the program in San Francisco. I was just there a couple of weeks ago visiting and had a chance to see that program. And so it's a really great program, and just looking forward to continuing that work.
Great. And then my last batch of questions, now I'm on page 12, the dashboard around the encampments. When do we expect that to go live?
So we're in the, I guess you would call it maybe like the early product development phase of it. Charles Lucen, who's a member of my executive team who's here today, has been leading that initiative for us. We've already looked at other cities to see how they do this work. I think just last week or 2 weeks ago, we were able to collaborate with CTM and some experts from ArcGIS to help us start designing what that looks like. So we don't have a firm launch date just yet, but it is one of our top priorities. And we're looking forward to bringing this to bear. It will give the community a sense of when they submit their 311 ticket, what's the progress being made on that ticket? Where have other tickets been submitted? And when we close out, tickets, you could also log in and you could see pre and post cleanup activity photos, narrative of how we help people or what actions we took to try to help maintain the public space, et cetera. So we look forward to bringing that to the community as quickly as possible. We have a couple of projects in line right before that one. But I know Charles and his team is working really hard to get that one to us as quickly as they can.
Great. Just have a few questions on the encampments. I know you had mentioned 1,500 encampments have been closed. Do we know how many still exist? And then further in my encampment questions, do we know when the encampments are closed, how many folks get into some sort of housing versus how many folks kind of pivot into another encampment? Yeah,
we track that as best as we can, and happy to get into the specific details with you if you'd like. What I can say is oftentimes if the cleanup or the closure is not well coordinated, people will mostly migrate to another plot of land nearby, private property or another public property, and we're just chasing folks. That's why we made it a priority this year to adopt the city's first coordinated encampment cleanup and closure policy. And so you saw the slide where I said we partner with 11 different departments to do this work. All the partners who are part of the encampment management vertical are bought into a coordinated process where if it's not an emergency situation, then it's coordinated with our office. We do outreach. We try to get people into shelter. We track how many come into shelter. And then those who don't, we give them time to gather their stuff and move on, and we track how many move on. But I can get you the specific data. I just haven't had a chance to pull it.
Great. No, thank you. Appreciate us coming together once again, and appreciate you and your team's hard work.
Thank you.
Thank you. Mayor?
Yeah, I just want to pivot off of something Councilmember Codry just said. He was there the other night. So was Councilmember Vela and several of y'all staff were also there when the ribbon was cut at Katie Lofts, which is a permanent supportive housing. And I'd made contact with Mr. Gray as part of that. And one of the things he pointed out to me, and I'll read what he sent back. He said, the resident who spoke, if you remember, Sharon, I think was her name, where she goes by Rose, very moving speech that she gave. He pointed out the resident who spoke was first contacted by an Urban Alchemy's street outreach team. So just what you were asking about. Then provided shelter at 8th Street, at the 8th Street Women's Shelter. Then updated her coordinated assessment at Sunrise. Then received move-in support from Endeavors, which is our marshalling yard operator. And as he points out, it shows the importance of the complete system. And that was just one example. And since you mentioned, you were talking about the outreach, the street outreach, I wanted to bring that up. And I'm not going to go into a bunch of discussion other than to say that I deeply appreciate the fact that, like Councilmember Velasquez said, we've stood up a homeless strategy office in the past couple of years that is now a homeless strategy office. And that's very important, because what you just did in that 45 minutes is dug deep on what we need as a strategy and where we have done well, but where we're lacking. And so, but it also covers the entire continuum, and that is pointed out by what the council member just was talking about. So I want to say thank you for what I think is an excellent job that the Homeless Strategy Office of the City of Austin is now doing, and this report in response to what came out of the Mayor Pro Tem's work and the committee work with that resolution, I think puts us where we were hoping to be with this joint meeting, and where we're hoping to be with regard to this budget. Maybe not all that's in there, but the point being, we are now, for the first time, I think, and certainly in the past couple of years, looking at the entire continuum, and we're looking at it with real numbers and with performance requests as part of that. And that makes for what we're getting ready to do in the budget process better. So thank you very much.
Thank you, sir.
Thank you. Yes, and just to build off of that, thank you for the presentation. A lot of good information is being shared today with us on council and in the community. And for me, there are three key areas I want to dig into. I'm a strong proponent of a housing first approach, but housing first does not mean housing only. The care and the case management and the peer supported services that we provide is absolutely key, which is why I really appreciate that you talked about emergency shelter, ensuring that the distinction between a housing focused emergency shelter versus a shelter. So the area I want to dig deeper on is case management, and just knowing the critical role that they play in our overall response effort, whether it's providing case management services in a hospital setting versus a shelter setting, out in the streets, or in our jail. With the proposal you've laid out here, what's the case management portion of it look like? Even from my first question would be within the department recommendations that you made to build out your department, how many more case managers would we have in-house versus how many more case managers do we need within the community and our partners?
Yes, ma'am. So our staffing recommendation does not look at case management in-house, at least not HSO, but it does look at some of those case managers at DAC, and that's just a little bit of the different roles that we play. As a strategy office, we set strategy and we fund a lot of organizations to do the direct service, but we don't do a lot of direct services ourselves. Unlike DAC, which does do a whole lot of direct services, and Court Administrator Kingham is here, to talk more about that if you'd like. However, when we looked at our funding recommendations, it was important that we looked at the cost of quality case management. Your case manager is your ally. It's your advocate. It's the person who's not just scheduling your ID appointment for you at the DMV, but they're getting you there, they're sitting with you, and they're bringing you back, right? It's the person who's helping you enroll in that medical assistance program or complete your housing packet. I mean, that is your go-to. And your case manager is going to meet you where you're at. They're going to help take you where you want to be. And so having those case managers in the shelter environment, in the housing environment, even folks on the street level who are engaging with people and building relationships and helping them get on shelter wait lists and check their positions and stay engaged, can receive a call from my team when we're looking for somebody and say, yes, I know exactly where my client is. I could help them do their transition. That role is so critically important. I also just want to thank our case managers, because that job is probably one of the jobs that goes most unnoticed because they're not at a dais, but it's the hardest work in the system. And so if there's any case managers in the room or just listening today, I just want to say thank you for your service, because that is probably the hardest job out of all the jobs.
Yes, absolutely. I mean, it's just a key piece of the overall response is having that quality case management service. There's a significant return on investment with it. We're talking lower costs on emergency response, lower healthcare costs, you name it. And so that's one area I'd love to dig deeper on as part of our committee work. The other area I wanted to just kind of summarize, you've laid out this recommendation. Your recommendation is $100 million is needed to adequately respond and address our homelessness response system and to have that strong continuum of care. With that, you've said, maintain about a third of it in ongoing funding and then inject another third into our response as a way to address the ARPA gaps, to address the federal funding cuts. So am I hearing you right that the recommendation coming out of your report would be an additional $33 million?
Yes, and so part of the recommendation, as you mentioned, is a third is looking at things that we are budgeted for one time in this year budget and continuing those investment recommendations. So that's about $33 million, and that includes ARPA cuts, the one-time funding that we're using right now to sustain the 8th Street Women's Shelter, the one-time funding that was allocated for homeless prevention, the one-time funding that was allocated for the Housing Connector program that helps us recruit landlords. All of those things are critical system investments that are having real results in getting people off the street and into housing. And so we don't want to lose the capacity that's so critical and so effective and so instrumental. In addition to that, we need to add more. Our system is successful. When people leave our system, when they exit homelessness in Austin, the majority of those folks will remain housed and they will not touch our system again. That being said, our system is just too small. It's like a 15-passenger aircraft trying to support 500 people. So we need to add more seats to the plane, and that's where the additional investment consideration from the city is being set forth. Also, the city can't be the only person investing in building more seats on the plane. And so we're also looking to other funders to align with us to also help us invest by essentially matching our new investment.
Very good. Thank you for that. And so with these investment recommendations coming to us at a perfect time, right, as we enter a budget season, what can the community expect from, like, let's say we are able to identify an additional $33 million to inject to the city's portion of the homelessness response system. Can our community, what are the expectations? Are we expecting shorter wait times? Are we expecting less individuals living out on the streets? Are we bringing a certain amount of people indoors? What does that look like for us?
Yes, ma'am. What the community can expect is a measurable reduction in unsheltered homelessness in our community. And that's been our priority since day one. And so what that looks like is quicker response times to 311 calls for service. And that's both from the resident who's calling to complain about an encampment to the person experiencing homelessness who's calling for help and saying, I want a shelter bed. I want to talk to somebody. I need medical access. So shorter wait times. More effective shelter systems, shelters that have higher positive exit rates and that are positively exiting more people. Some of our shelters right now have decent exit rates and maybe turnover beds once or twice a year. We could have higher exit rates and also use the same bed to serve 3 to 4 people annually. Also having more positive exit rates for interventions like rapid rehousing. We know that if we serve folks who are not chronically homeless in that intervention, about 67% of those people will exit positively. Whereas if folks are chronically homeless in an intervention, that success rate drops to about 30%, and we're feeling the effects of that now. So we want to make sure that if we're investing public dollars in interventions, that we're using data to inform our decisions, and we can tell the public with some degree of certainty that your taxpayer dollars, my taxpayer dollars, because I pay property taxes here too, are truly helping people exit homelessness. And so that's what our system looks like, or that's what the system would look like if these funding considerations, not recommendations, because I could feel Carrie Lang looking at me, but these funding considerations are brought forth.
Very good. Thank you. Oh, yes, Councilmember Alter.
Thank you, Rose. I wanted to kind of pick up right where you left off, and you mentioned Director Lang. I was hoping I might ask her a couple questions to just get some ultimate clarity on what the Mayor Pro Tem was asking about.
Does this mean I could sit for a second?
It does.
Thank you, sir. I appreciate it.
You look like you could use a little spell.
Good afternoon, Carrie Lang, Director of Budget and Organizational Excellence.
Good afternoon. Thank you so much. So I wanted to just get a clarity. We had a couple weeks ago, your office presented that right now the expenditures that we have from the current budget moving forward leaves us at our current 3.5% cap about $33 million short. Y'all are going to be looking to figure out how we might close that gap, but that's where we stand today. Is that correct?
Correct.
And then within that, or I should really say separate from that, was all the ARPA-funded programs that are not even part of that $33 million gap, but there's an additional, and you identified $18.1 million, and I forget what the exact number that was identified here. I don't have that slide, but there you go, 15, phone a friend here. But that amount is not incorporated in the $33 million. That's an additional cost that we would have to find just to maintain our existing programs, correct?
That is correct.
And then as David and the Mayor Pro Tem were talking about, to then layer on those investments, so not just maintaining our service levels, but to do more, that's an additional about 33 if you're just looking at the potential city third. So it's 66 or somewhere in the 60 range to do the city of new funding for the city, that the bit for the ARPA and then the bit for the city. I'm not saying that as well as let me try again. Baseline is today, to get the ARPA funded programs, we need to add beyond our current budget. That's we can't close that in the gap. That's an additional investment.
Correct.
15, 18, whatever. Then and as David mentioned, just to maintain current services, some of those services, and this is where I'm losing myself a little bit, why I called you up here. There's that third that he mentioned of maintaining current services. And some of that was ARPA funded, but some of that was just current things that we're doing within the Homeless Strategy Office, correct? Is that a correct understanding
I'm going to
of that?
say that is correct. Some of those dollars that are in the 33 that David Gray mentioned are part of the ARPA dollars, but there are some additional dollars too. For example, some of the homeless response, that is part of the additional part in addition to the ARPA dollars that we mentioned on a couple of weeks ago. So there's a little bit of overlap, but not complete overlap.
Got it. And where I'm trying to go with this is that assuming we don't cut homeless related programs to balance our $33 million deficit, that means we need, as identified here today, 15.65 of new money for the ARPA programs that are not accounted for, plus we'll say the third of that new investment. So that's around, I guess, about $50 million of new money that we would have to come up for with the budget, next year's budget, to do that. Is that a fair characterization of the number?
After conferring, yes.
Okay. And that's just, I wanted to get an understanding of how much we need to bring to the table, and really there's only one method to get $50 million of new revenue to the city, which would be to ask taxpayers to foot that bill. I mean, we can't raise our sales tax rate. We can't raise fees to do that. We would have to ask the taxpayers to invest in our community and in this priority. Is that a fair?
That is a pretty fair assumption. Yeah, I think there are some things we can do to look at prioritization of services and things that, what are the focuses of the city, but to raise this large of amount, I don't know if there's that much prioritization that we can do as a city. I think there would be a request to go to the taxpayers.
Okay. And why I think it's important to have that frame is that when we're going to taxpayers, and this is exactly on the question that Mayor Pro Tem asked, we have to tell them what they're going to get for that investment, right? No one's going to just say, yes, I want to pay more because it feels good. They want to know what's that tangible result, what do they get out of it? And we have had, as a city, a number of plans. I forget all their names, right? But we every 4 or so years we have a new homelessness plan of how we're going to combat homelessness, and that's, times change, so you have to update your plans. But we have to show the public that we're going to actually deliver success on those plans. And so within that, I think it's my great struggle in this whole analysis is that we can't do it alone, as David mentioned. We are just one entity, and it's a big number. But we also have to set ourselves up for success, so that if we ask the public to invest in the city, and what we are saying that if you give us the money, we will achieve X result. If we don't pull along those other outside funding, then we deliver some, but we don't get the full systematic success, given that we have the rapid rehousing and the permanent supportive housing element heavily as part of that public investment. And so I bring this up to just have us think about if there is something discrete within whatever we decide to do, whether it's this plan or elements thereof, that we have to set ourselves up to prove to the public that if you invest in us, we will deliver the results. And so if that's focusing on a subset community, like we heard, LifeWorks came and talked about how you could address youth homelessness. There are other subsets out there. Or if it's looking at a certain intervention and saying that we're going to prevent this number of individuals or divert this number of individuals. I just think we have to make sure that whatever our investments are, we can prove to the public that they're going to get what they invest in. And so that's not a question for you, just a thing to think about, I think, for us all, and as we try to pick out in this, because if we ask for this significant amount of investment and we don't deliver, I'm afraid we never get that chance again.
Thank you. Thank you, Councilmember Vella.
And thank you very much, Mayor Pro Tem. I'm gonna, I think, kind of ask the same question. I'm just trying to kind of really pinpoint it. But honestly, before that, I did want to say thank you for the presentation. And I also, it's a tough job. I really thinking about your predecessor too, Diana Gray, before there was a homeless strategy office, when she was a division of, the Austin Public Health. Oh boy. That I think, and thinking about the cross coordination. So I did also just want to call out, I can't remember, I think it was our former interim city manager who made the recommendation and said, we need a homeless strategy office that's independent, and we need to move all the contract management in there, and we need to actually give the power to do the things that we say we want them to do. That was a great decision. I'm so happy that happened, and I think just from the dais perspective, it feels like things are moving quicker, and more kind of deliberatively through the process. So just wanted to mention that was a really good. Substantively, so what would be the number to, and like I said, I think that this is what Ryan was asking, but to maintain everything that we're doing right now, including, again, we've got $15.65 million in ARPA funding, and I'm looking at that list, and I don't see anything that I want to discontinue. And then we are talking about, we had some one-time funds in the budget as well, and also any expiring federal funds that, especially anything relating to homelessness in particular. And so did I hear correctly that that number is in about the $18 million range? Is that about where we're at?
The 18 million that was a part of the ARPA presentation, it was the 15 that David mentioned earlier today, but it also included some funding from Austin Public Health and Economic Development Department. So there were some smaller programs that they had as well in that full 18 million that we discussed on ARPA. I think the staff is continuing to look at what other federal dollars may be impacted going forward, and I would ask that we be able to give you that full breadth of the total dollars in the coming days as we break down all that information.
Got it. But so our baseline then would be that 15.65 of ARPA plus, again, in the 3 million, 2 to 3 million, $2 to $4 million range of potentially other funds. Again, I'm just trying to understand in terms of, I know, I'm absolutely sure that I do not want to do less than we did last year. I mean, that's a kind of a baseline level of, no, we've got to continue to do what we're doing right now. I think where we go is a totally separate question, but just in my mind, I'm trying to kind of be like, what? So then, again, just $33 million plus $20 million, $33 million budget deficit, just kind of ongoing because of revenues and so on and so forth, and contracts that we will also be negotiating, firefighters and whatnot. And then we're talking about $20 million on the homelessness side of ongoing programs that we likely want to support. Is that a fair kind of?
That sounds fair, and I guess I want to just say that staff is working on addressing, of course, the $33 million that we have talked about during the forecast period. And so I think there are some things that we are going back and looking at from as we craft the city manager's proposed budget. But that is what we're looking at, the $33 million from forecast, in addition to the numbers that David gave today.
And I completely agree. And now that this is going to be my fourth budget, I can't even remember now. There's fund programs that are expiring, or maybe that we want to reallocate, or whatever the case may be. But I don't see how we get to $50 million without new revenue. I mean, that's just I've seen y'all work much smaller numbers, successfully work much smaller numbers, but the reality is that I just don't see how we get to that level of investment. Again, we're talking about essentially still baseline. We're just trying to maintain current efforts at that level. And I'm not going to speak for my colleagues, but my constituents really want to increase the levels of support and cleanups and housing and maintenance and all those kinds of things like that. And again, not to belabor the obvious, but the only way we get there it's likely going to be a tax rate election.
Councilmember,
Great.
sorry, we were over crunching some numbers really quickly. So just to sustain what we're currently doing, we're talking about the $15.65 million in the ARPA for the HSO, but as Carrie mentioned, there's other departments that do stuff too. In addition to that, then it's $7.3 million, which is the $3.8 million bucket for the one-time prevention, diversion, and rapid exit programs that we're running, as well as plugging a $3.5 million funding gap for the H Street Women's Shelter. So when our office inherited that shelter, one-time funding was attached to that. We've been managing that budget through one-time cost savings that we've been able to find. Unfortunately, that's not going to be as easy for us to do going forward. And so the total is the 15.65 from ARPA plus 7.3 and other one-time that's in HSO's budget, and that would just be to sustain what we're currently doing.
So the 8th Street Shelter is not part of the ARPA program funding.
No, so
That's
Marshalling
outside
Yard,
of that.
correct. Marshalling Yard is funded through ARPA currently,
Yes.
and some other one-time, because Carrie Lang's done some great budget jujitsu this fiscal year. But 8th Street Women's Shelter is not ARPA.
So again, then we're talking about closer to like a 23 million
22.95,
Okay,
according to my math.
got it. And that's the total. Again, we're into the $50 million. I mean, into the mid 50s, honestly, at this point. Great. That was the clarification, just for in my mind, so I could understand exactly what we're looking at. Again,
Well, and just to add, so 22.9 million to sustain, and then the recommendation is an additional 33 million for these enhanced strategies and investments to better serve our community. Correct?
Yes. Yep.
yeah, and I appreciate the point, Mayor Pro Tem, because again, the baseline, the absolute is to maintain, but we've got to look at what we can do, because there's just it's draining also all our other. I mean, our public safety services. It's this whack-a-mole that we play with the encampments is also very expensive, and I don't think it's as effective as other strategies. So I completely agree that we've got to get to a better place with our overall homelessness response system, and I appreciate the plan that you've laid out.
Thank you, Councilmember. I think we have final questions from Councilmember Duchin.
Thank you, Mayor Pro Tem. First, thank you so much for a very thorough and very informative presentation. And I also want to thank you for just your availability to me and my team. I really appreciate you jumping on calls and helping us step through a lot of this stuff. Over the last couple of months, I also want to say just thank you for the focus on a lot of data and technology and reporting that you've included as part of the solutions that you're presented today. I think that probably go a long way to helping me better understand and also feel good about a lot of the solutions that have been proposed. And then also just one last thing, which is to thank you for the controls that you put in place already. I know we've talked about some of those things for some of the contracts that the city currently has. So first I want to build on Councilmember Velasquez's question, which was about looking at other cities. I know it wasn't probably part of the scope of what you were directed in the January resolution, but either through that or independently, have you looked at other Texas peer cities to figure out how they're addressing similar challenges, funding their programs, funding their positions, even working with their COC and their homeless ecosystem? Any conclusions, if you have looked at those other examples about what they're doing, what we might even be able to borrow from as we're trying to navigate the financial challenges that my colleagues have already noted?
Yes, sir. So we've had conversations with other offices to understand how they fund their homeless response systems. I think in some ways, Austin is a little bit of an outlier when you think about the amount of general fund dollars that we contribute to prop up our system compared to other cities that might draw down on federal funds, some of which is emergency funds from hurricanes and stuff like that. Other cities have a very robust philanthropic and corporate giving culture, where philanthropic organizations and large corporations will fund significant parts of their shelter operations or housing operations. That just historically hasn't been the case here. But that is part of the reason why we felt like it was important today for us to start highlighting places where we feel like other funders in our system can begin to align with the city in ways that we think make a lot of sense for our system here.
And when you talk about the HRS, does that include the philanthropic community that you just mentioned? Other cities
Yeah, so when we talk about our homeless response system funders, that includes other taxing authorities, philanthropic organizations, our business partners, and individual households who like to contribute to their favorite nonprofit organization.
And is there anything in that space that other cities are doing that's particularly effective that we could be doing in terms of, again, meeting the financial obligations just to sustain our current level of operations?
From a funding perspective, or
in a philanthropic perspective, as you've looked at, again, other examples of how, and had those conversations you just mentioned.
Yeah, when we went to Denver last year, and I took some time meeting with some folks from their city and the Denver Community Foundation to talk about some approaches that they're taking to really align city funding and what's happening with their philanthropic community. It's a funders table of sorts, but it's a space where foundations, individual contributors can donate money and donate resources, and then the city and the philanthropic community work together to figure out how to program those funds. And there are other examples like that, where either offices have staff that are directly responsible for interacting with foundations and business partners to help bring alignment to shared tables and shared spaces. That is a goal for our department, and we do plan to lean into some of that work this year. And we've already had, in preparation for today, we've already had some great conversations with local philanthropic organizations who talk to us about their strategic plans, where they think they might want to invest funds. But obviously, we're very interested in the discussions today as a starting point.
Thank you. Okay, well, that makes me feel more optimistic. It sounds like there are programs or models like in Denver that we can potentially emulate. It sounds like you're already taking steps to do that. My concern around that is that it feels like every time we are asking the city to step in as a funder in this space, we are sort of asking everybody across the entire spectrum in Austin, including people that might be on the cusp of homelessness themselves, to help participate in funding these programs instead of asking folks that have means, that are part of a business or philanthropic community that it sounds like, again, you talked about in Denver that have. So it feels to me like that might need to be an integral part of whatever your solution is that you're working on. And again, encouraged to hear that you're taking steps already in that space. In terms of how you split up costs between the city and HRS, how did you figure that out? I appreciate the level of detail that you presented here, but what was the sort of methodology used to get there?
Sure. Really, we tried to base our analysis off of the conversations we were having with other partners in the space and really understanding where their investment priorities were, where they felt comfortable spending resources, and the type of outcomes that they want to see from that work. It wasn't necessarily the case that we went into this project thinking, in chunks of thirds. And obviously, we want to continue this discussion with other system funders to figure out what their level of interest is, what their comfort level is in terms of aligning funding with the city. And so we really see today as a starting point for an ongoing conversation. But our analysis thus far has just been based off of the conversations we've had with other funders in this space.
So another question I've got is, I'm trying to figure out, we saw Dr. Schoenfeld's work earlier that showed the acceleration or the increase in at-risk youth and homelessness. Trying to figure out also, how are we sort of what are the other underlying spaces that we might need to have specific solutions for? I know you and I have talked about mental health. I know there's some legislation in the Capitol right now that's maybe going to try and address some of those gaps in that space. I realize, again, maybe outside of the scope specifically of what we asked you to do, but where do you see those opportunities to implement specific solutions, whether they're at-risk youth, whether they're mental health, that can help us tackle this other than just housing and shelters and the things you ran through?
Yes, sir, definitely. First, I want to thank Liz for her presentation today. Liz and I co-chair a working group that's a variety of city departments and state agencies and other foundations and other partners to talk about the foster youth homeless pipeline and how we bring strategic interventions to cut off that pipeline. And so, Liz, if you're still here, thank you for that. Yes, we are working, with our government relations office, having great conversations with state lawmakers of all parties to talk about the need for mental health services in Austin and in Travis County. A lot of the clients who we see need mental health care, and we just don't have a place to take them. And unfortunately, our shelter system is not equipped to serve those clientele. And so we see a lot of those folks cycling out of ERs back to the street or jail back to the street, and somewhere in that cycle they pass away. And so we want to make sure we're bringing the mental health services to bear so that we can get folks into the appropriate health facilities to address their underlying needs, and then begin to work with them on all the other skills that they need to really stabilize and improve their lives. We're also seeing some needs around family homelessness, specifically families with young children. I was just talking with my outreach lead, Patricia Barrera, today about a call that we got on Friday about an encampment with a young child in it. And so making sure that we have appropriate and responsive resources for our families that are sleeping in cars or sleeping in camps with kids under the ages of 18. And then lastly, one that comes to mind is our seniors. A lot of our seniors are on fixed income. And that fixed income is not rising with the cost of living. And so we're seeing a lot of senior citizens fall into homelessness. I'm really grateful that we were able to get Pecan Gardens open last year. I know Family Elder Care is in the room today. They do an excellent job managing that facility. That facility is specifically for chronically homeless seniors, and that facility is either full or close to being full. And so we are, we didn't talk a lot about subpopulations today because that wasn't part of our charge, but we are paying very close and careful attention to our subpopulation groups to make sure that we have the right mix of responsive interventions for those individuals.
Okay, thank you. The last question is really just about going back to my original question about peer cities and looking at San Antonio and Dallas and Houston and so on. One of the things I've tried to do since we first talked about this back in January was try and figure out how some of the other cities are doing and what they're at least spending in the space, particularly as we get into a complex discussion about what we can afford just to sustain services, if not expand them. And I was kind of surprised to discover that, at least as far as like affordable housing bonds, we spent, I think, almost 5 times as much as the next closest Texas city. And we're spending operationally in a budget more than any other Texas city from what I can tell. So if I didn't know any better, I would assume we are doing way better in this space than what I heard from the testimony 2 hours ago. Can you help me figure out what is going on in Austin, what's unique about our environment that we are needing to continue to spend more and continue to step up housing and services? Is it local economics? Is it some other factors? Like, what's driving, in your opinion, what's driving a lot of this?
Yes, sir. It's very challenging to compare 2 different cities, even within the same state. But when we look at like Austin relative to some of our peer cities in Texas, one thing is the rapid rising cost of living in this city that we've seen recently, especially during COVID, when Austin was the hottest place to be. And at the same time, us having a housing shortage. And so you saw a lot of people lose their job because of the pandemic, also not able to afford their rising rent. And you didn't necessarily see those same pressures in some of our peer Texas cities. So I know that's one factor just kind of unique to us. And we know through recent data that a lot of people who are living unsheltered homeless in Austin are from Central Texas, or the first time they experienced homelessness was when they were in Central Texas. That being said, we meet pretty regularly with our peer city partners to talk about what homelessness looks like in San Antonio or Dallas or Waco or Fort Worth. and try to compare what we're seeing trend wise and talk about different solutions that we're trying and whether or not they're working. And so I definitely appreciate the question. I'm just always a little nervous about comparing two different cities because the hyper local situations around local economies and local industries and local zoning and whatnot kind of come into play, and it can get real messy. But we're happy to follow up with you and your staff at the appropriate time to really dig into that level of analysis if you'd like.
No, that'd be great. I'd look forward to it. Thank you so much.
Thank you, sir. And Mr. Mayor, if I can just really briefly, Councilmember Codger, you had asked about the money you had appropriated to the Homeless Strategy Office for Permanent Supportive Services. My finance team did confirm that those dollars were allocated to a project. And because that was one-time money, we actually attached it to our at-home work, which is also one-time money. But it has gone into supportive services. So those dollars have been used, and we appreciate your work on getting us that allocation.
Great. Thank you.
Thank you, sir.
Thank you, colleagues. Any final questions, comments? Well, thank you all for, yes.
Sorry, I do have one final comment. I know, David, you had mentioned it, and some of us have been able to attend it, but I just want to thank Sally from Katie Lofts. I talked to the mayor about this during the ribbon cutting. You know, for a lot of folks might not realize how much of a struggle that was and how many folks didn't want that project to happen, but also how necessary that project is and how the folks that live in Katie Lofts, like Rose, who I think believe the mayor had mentioned, is just as much as our neighbor as anyone else. So, you know, I think we need more Katie Lofts around the city, and I just really appreciate Sally's work, but also everyone's work who made it possible.
Thank you. Thank you, Councilmember. Thank you, colleagues, for today's really important and robust conversation. Thank you, staff, for all the hard work that y'all did in providing this report. Lots of good information, and know that the work is not done. In fact, next week we have a special call meeting of our Audit and Finance Committee, and we have our regular Public Health Committee meeting. So that's two more opportunities for us to continue the conversation next week as we lead into this budget cycle. Seeing no further business and with no objection, I adjourn the Public Health Committee special call meeting at 3:10 p.m.
Without objection, the Audit and Finance Committee is adjourned at 3:10 p.m. Thanks, everybody. Great meeting.